Crikey, that was a long one. We are talking Emmerdale now in a very important storyline that's seen Dr. Liam hiding some worrying symptoms.
What are you doing?
Oh, my God.
I'm going.
No, please stay. When I need to go, I need to go. And when I do go, I don't empty. And then I go again and again.
How long have you been like this?
Just a few weeks. Months.
Well, Dr. Hillary is here to talk about this, and we saw Liam there having all sorts of issues. Not, of course, all men get these symptoms, but let's join Jonny and talk to him, because this is a very, very important storyline. He's a doctor. I'm shouting at the television. He's a doctor. Why is he not doing this? Why is physician heal thyself? So what's going on there?
Yeah, no, I'm sure it is frustrating to watch. I think predominantly the main reason for him not saying anything is because of Chaz. So she's recently gone through a breast cancer storyline. Obviously, the Dingles have a kind of... there's a genetic cancer issue that runs through the family. So I think in his head, he feels like he just wants to absolutely ensure that if he does suggest that any of these symptoms could be cancer, he needs to be absolutely certain. Otherwise, you know, he could just be causing undue distress.
Sure, and you can understand that from the way that we've seen that relationship and how difficult it's been for her to go through all of that, and how, you know, your character has helped her through that. But it just shows you, again, what I think is really clever about this storyline. It shows you that men can be still, after all this time and all the campaigning and everything that's been done, and, you know, the Chris Hoy effect and all of that, they can still be very reluctant to go to the doctors and find out.
Well, I'm glad you said it. Yeah, no, absolutely, because it's. I mean, you don't want to make sort of sweeping generalisations about stuff, but I think, yeah, I mean, men are, especially my generation above, very poor at getting stuff sorted out, and especially, I guess, as a doctor, he's constantly giving advice as to, you know, if anyone feels the slightest niggle or concern, then they should get it checked out. And then he is obviously feeling all these things. I guess as well, as a doctor, you detect symptoms and you have a multiplicity of like possibilities. Yeah. So maybe he's just sort of painted himself into a corner slightly. Yeah. But yeah, I mean, men, there is definitely a tendency of just kicking the can down the road. It'll be all right. It'll probably pass.
And that's what a lot of men do. They really do.
Yeah.
You've worked very closely on Emmerdale. You know, obviously all the writers, producers, and yourself with Prostate Cancer UK. I mean, if this gets, and this is what I always say about our soaps and our dramas, that they can do such a great job of raising awareness, because you can do all the campaigns in the world, but people really relate to you and relate to the character you play.
Absolutely. I mean, it's the. I think it's the unique selling point of a soap continuing drama is that you have the opportunity to watch storylines played out in real time, day by day by day, and also you're watching characters that you've invested in over the course of years. So, yeah, I mean, it's not the same as watching a 6-part drama or a feature film. You're watching characters that feel like part of the family a lot of the time. So, if issues are raised, then, you know, if it's said lots in the past about topical issues, but if one person watches this and goes, oh, maybe I should get it checked out, and then manages to nip a problem in the bud, then we've done a great job. You've
absolutely done your job. And as I said, Dr. Hillary is here. We saw that Liam's had this problem of wants to keep going to the loo, but never feels like he's emptying his bladder kind of thing, you know, and he has to go back again.
Yeah. So that's a common symptom of an enlarged prostate.
Right.
Now, most enlarged prostates are going to be benign, but 1 in 10 might be cancerous. So it's a really good storyline. We're raising awareness, and he's absolutely right that doctors are often the worst patients.
I know.
Because, one, they're busy, so they never get round to doing anything. Doctors aren't used to going to see another doctor to talk about their own symptoms, and they put things on the back burner. They kick the can down the road, as John's just said. So this is a problem, but to raise awareness is good. Now, a lot of men who develop prostate cancer, 1 in 8 will, in their lifetime.
Gosh,
many
high,
men with prostate cancer will die of something else. They'll die with it rather than of it.
Okay.
But younger men who get an aggressive form of prostate cancer may or may not get symptoms. So that symptom of frequency, having to go more often, urgency, I've got to go now,
Yes.
is a very common symptom of an enlarged prostate. But also we've got nocturia, getting up at night to empty the bladder, feeling that you haven't completely emptied your bladder each time, a weak stream of urine, so you can't pee as high up the wall as you used to when you were 21.
Gotcha.
Men will talk about that.
Yes.
Also, hesitancy, not being able to go as quickly as you want to sometimes, and dribbling at the end of the stream. These are common symptoms, but let me just say that these aren't always prostate cancer symptoms. They could be benign enlargement, which is usually the case.
So the quicker you get it sorted out, the quicker you go for help, the better.
Yeah.
You know, that's the thing. And we have had, sadly, I mean, we remember Paul Burrell come in here and shared his story. That saved lives. Chris Hoy, as I said, the Chris Hoy effect is saving lives. So the message is out there, but we can't say it often enough. And I think it's brilliant. I really do, Jonny, that Emmerdale's doing this. More power to you. And thank you so much for joining us. I can't wait to see what happens. Fingers crossed it's going to be OK. But thank you so much. And Chris Hoy said, we've got to get the screening age down.
So we know that some people are more at risk. So people who are over 50, with increasing age is an increasing risk factor. People who come from an ethnic background from African or Caribbean origin are more at risk. And if you've got a family history, a father, a brother or a son who's had prostate cancer at a younger age, clearly you need to get that PSA test done as soon as possible. Anybody over 50 can go and ask their GP for a PSA blood test. It's not perfect by any means. You need to understand it's not perfect because 75% of men who've got a raised level won't have prostate cancer, and 15% who have a normal level will have. So it's not specific, it's not that sensitive. So we can't screen everybody, it wouldn't be worthwhile, but if we screen those people most at risk, we will detect more cancer in the early stages, and that's what we want.
Of course we do, and we can save more lives. Of course we can.
Absolutely.
Hilary, thank you so much, and well done to Emmerdale for doing the storyline. It's excellent. We've got more help and support on our website, as you would expect.